Hi, Victoria here. Welcome to the Bothy Therapy Room, where today you get to see the whole of Hannah's beautiful core therapy treatment. This was the very first core therapy that I posted on this lovely YouTube channel, and it's done really well. It's had quite a few thousand views already. Hannah's blown away by that. I think she's put a comment on her YouTube video so that you get to see what she makes of core herself. And she has gone from strength to strength after her series of core therapy treatment. So I'm really delighted at her testimonial, but also the way that she leaves here feeling great after each treatment. So I'm sure you can now sit back, relax and watch the whole treatment from start to end. So let's spread a little healing, guys. I'll see you again next week.
Yeah, so the reason why I originally came was I'd wake up with neck pain at the top here, and when I was walking I had really bad posture.
All right, so we're going to put our masks on.
Yes.
I'm going to put my gloves, mask and visor and we'll start the treatment.
Okay, great.
What I'm doing here now is kinesiology, also known as muscle testing. So I'm checking her muscles to see where her strength or weakness lies. And as you can see, I found she was dehydrated. So she's had a glass of water, I'm retesting, and I'm finding better muscle strength. Certainly on her right side, this is called an IPSI test, but on her left there's some weakness. So what I'm doing is I'm trying to find in the back of the pelvis on the side of the sacrum where the weakness lies. I'm retesting once I've anchored it, and yes, I've put a lot of pressure and muscle strength on there and it went strong, so that's really good. I'm constantly updating my notes so that I can keep checking her from week to week and make sure she's getting better. Now I've moved on to a contralateral test. This is across the body, and this actually tests the walking gait. So I'm using these tests to see how her muscles respond. They should be responding strongly. When I find a weakness, I do something called anchoring. So I'm anchoring her wrist point or her ankle point, which is actually in a really strong Chinese meridian. And what it does is, I like to think of it creating a shopping list. So every time I find a weakness, I'm adding it to the shopping list, as you can see I'm doing here, in order to help repattern and add that into the treatment, so that when I'm treating, the body will have this shopping list in its subconscious, and all of these weaknesses will be helped by the treatment. So what I'm doing here now with the contralateral test, I found some weakness in her right side arm and left side leg, and I'm just locating them now. I've noticed that the elbow has some weakness in the front lateral side, and that's definitely just where I touch there. And then I come to the knee because that came up weak as well, and I'm going in for more detail here. So I'm twisting the knee in one direction and then in another direction, and whenever she tests weak, that's where I know the weakness in the knee is. So I'm using her left arm as what we call an SIM, a strong indicator muscle. Now I'm coming down to the ankle because this one tested weak as well, and I'm moving the ankle in lots of different directions in order to find out exactly where any weakness may lie. And then when I find a weakness, I'm anchoring it into that shopping list, and then the body, the subconscious, knows about every little place that needs more attention. Core therapy is all about asking the body that you're working on to start healing itself so that it doesn't rely on treatment. And we don't really want people to be coming to us every week or even more frequently. We want people to be able to be independent and the body look after itself. So we encourage people maybe to come at first quite regularly, and then the treatments will be more and more spaced out so that the body is looking after itself. This is the best way to be. So yeah, I've found in the ankle a weakness, as well as the right elbow. And now we're doing a test called a psoas test. The psoas is the couple of muscles in the pelvis, and they relate to the kidneys and also to the neck. And because Hannah in the past has had headache issues and psoas weakness, this is one that I was so happy on this particular occasion that both psoas came up really strong. It can be a difficult test to pass, and she passed it really well. So now we're doing something called a ballet test, which is actually working out if the pelvis is happy opening. So by opening the left leg in this manner, we're checking if the pelvis is happy opening, small, medium, and in its large range, as you can see here. So I'm using an SIM of her right arm, and the same with her right side pelvis. And you'll notice that her knee is far more raised. It's actually turning her body to be able to raise her leg up like that. And that's not good. It's probably back to, bless her, many years ago when she was an infant, she had meningitis. And this meant she had to have operations and after effects of the disease. I know she won't mind me telling you. So this is one of the reasons she first came to me for core therapy, and it's something I'm always checking with her, that her hips and neck and spine are working better these days in order to keep her aligned and healthy. So now I'm checking her pelvic girdle, I'm checking her iliac to make sure they're intact, to make sure the pelvic girdle is all connected. And this is one she's doing. It's called a pubis symphysis check. And she's touching the very hard bone at the very bottom and front of the pelvis in order to check that it's intact. And whenever you find a weakness here as the core therapists, we always check a little bit more in detail. So I'm asking her to move her hand in different manners, so upwards or downwards, in order to check the ligaments. Because quite often the ligaments all around the pelvis here can be strained, they can be twisted, stretched, or too taut. And so we're checking to make sure they're healthy, and in this manner I did find a couple that were weaker, so I will be spending some time on her pelvis during the treatment. Now this is a fantastic kinesiology check. We are checking here for a valve called the ICV, the iliosacral valve, most important for overall health. Now I'm checking the liver and the gallbladder. Now a point called the AP, the anxiety point, and the stomach, and the spleen. I'm not so happy with that check. That felt like it was a weakness. And this one is called the Houston valve, which was really good that it passed because it's failed in the past. And now one called Ren, which is really important Chinese meridian. I wasn't too happy with it, so I'm rechecking it. No, it's too weak, so I'd definitely be coming back to that. Now I'm checking kidney points, nice and strong, and adrenals, also nice and strong. And I'm really happy with all of that because in the previous week most of them had come up as fails, and so it's just Hannah's body alerting me to the fact that the abdominals and, if you like, the immune system needed some TLC. So in the previous week I'd actually given her an Anmo Fu, which is an abdominal massage. Now Hannah turns over, ready for just a couple more tests before the treatment. I'm asking her to bend and raise her knee, and this is testing the strongest muscle in the body, the gluteus maximus, and it should be really strong. Testing it on both sides. If it were to have failed on both sides, it means that the neck, the C2, cervical 2, would have been out of alignment, but actually it passed really well. Now I'm using her little finger and thumb as a muscle test in order to use that to check all sides of the sacrum. Some of them come up as weak and some are strong, which can happen with a pelvis out of alignment because it's twisting the sacrum in one or two directions. And now for the treatment. This is the most amazing massage, Chinese massage called Tui Na. Tui Na means pushing and grasping. There are other forms of Tui Na. For instance, Chun, which is pressing, Bo, which is rubbing, Yaw, which is rotating, Chen, which is pulling, and there are other ones all to do with manoeuvring like Ro, Nai and Pai and Ko. So I'm using all of these different motions and pressures, maybe one hand at a time, maybe I'm using two but one in the main, as you can see there. So one is tending to give stability, and one the actual, if you like, the technique, the treatment, the reassurance. Lovely grasping mechanism. This feels fantastic. So I'm picking up the muscles, I'm gently squeezing them. I've got my thenar muscle, that's the base of the hands, all down and across the spine. I'm looking for two things. I'm looking for fixations, so that's when one vertebra is fixated against another vertebra, which it shouldn't be. They should be working together independently. And I'm also looking for subluxations, which means where a vertebra is slightly left or right of its normal range of alignment that it shouldn't be. And wherever I feel any of these fixations, subluxations, I give it a little bit more time and warmth and treatment. But what we do in core therapy is we actually come back to it. So we might notice it, but we don't actually spend too much time there at first. What we're trying to do is create warmth, fluidity. That means blood and chi and movement, that lovely energy through the body. I'm feeling the spine there. You know, in other therapies I've done over the years, massage and aromatherapy for instance, we were always told never push on the spine, never put any pressure on the spine. Whereas actually with core therapy, in Chinese TCM, is we now know that you can put pressure on the spine. I'm not necessarily pushing down on it, I'm pushing across it, making sure that those lovely vertebrae and discs are moving independently. Yeah, I've got my hands over Hannah's sacrum, right, and I've got my thenar muscle right into the edge of her sacrum. This is such a wonderful, relaxing fluid treatment. I'm ensuring that the gluteus maximus and that latissimus dorsi on the side of the body. I'm up now around the trapezius, the deltoid. I'm trying to isolate the shoulder, and I'm using my hands in order to work them independently so that the right hand is pushing the shoulder down, whereas the other hand is pushing the soft tissue upwards. So I'm creating a twisting mechanism there. It feels so nice, so relieving to have this done. And now into the kidneys. This is a lovely area to have massage, just north of the waist, either side of the spine. A nice, warming, gentle, pushing action either side on those kidneys. All around the pelvis. She's starting to move so much better now. When I first started this, she was sort of moving like one long, rigid spine, and now the spine is moving like a snake action, which is great. Now I've noticed that the thoracics between about T6 and T12, so in between her scapula down to the bra line, were quite tight. So what I tend to do is warm the rest of the body and then come back to that area. And as you can see, I'm isolating that shoulder. Hannah's suffered with headaches a little bit recently. Quite often that can be down to neck and shoulder tension, strain, compaction. So I'm making sure that there is space and fluid there, down to the side of the hip. It's like being rocked in a cradle. It really is like going back to being a baby again. It's a lovely feeling of coming home. And now down to the foot. So I've now got Hannah's left foot, and this is called a foot repatterning. It feels so nice. I've got the base of her toe with 2 thumbs. I'm securing it at the back. I've got my knee underneath her ankle and shin so that she feels supported. And then I'm bringing my thumbs down. In reflexology terms, this is actually the thyroid in that point, just there, yeah. And then all around the base of the ball of the toe and down the kidney, ureter and bladder. So what this action does is to help flush out. It encourages fluid loss, which means a diuretic. We give a lot of warmth to that kidney, we're mobilizing, reassuring it. In Chinese therapy, the kidney's negative emotion is all about fear. So what we try and tell the kidneys is everything's okay, there's nothing to be scared of. I'm going to give you warmth and reassurance. So this feels so nice around the foot, separating the ball of the toe and the toe itself. In our bodies, this is separating the scapula from the back. It's like you've got your arms in a nice yoga big circle. I'm tuning into the feeling here. I'm seeing colours behind closed eyelids. I know Hannah will be as well. This is such a deep therapy, central to your core. So now I'm just getting ready for something called leg repatterning. And this is really interesting because it's actually using the leg as a lever to work on the pelvis. And I know this looks really strange. I'll be asking Hannah about this at the very end of the treatment and how it felt. But it's one of the most amazing treatments in order to ensure the pelvis is aligned correctly. I've seen it work hundreds of times with so many clients to good effect. So now I'm using the same technique on the right foot, concentrating at the moment on that toe area. This feels so nice. Again, separating the ball of the big toe and the big toe itself, massaging around on the big toe ball itself down where the thyroid is in reflexology terms, and then down on that kidney, reassuring, telling the kidney everything's okay. And then coming down, kidney to the ureter to the bladder. Absolutely beautiful. This is such a nice feeling. You know, we hold a lot of tension in our feet. There are numerous muscles, bones, ligaments, tendons, and they all need to be reminded to let go. A bit of foot repatterning, working on the ankle, making sure I'm holding the correct acupressure points, and now doing a little bit more of that leg repatterning to work on the pelvis. Beautiful. I'll just give them a little rock to reassure them, to make sure the muscles are letting go. Now, this is something called sacral fixation, and my eyes are focused on the sacrum right now, i.e. the lower back, and I'm making sure that the sacrum is balanced. If it's not, then I'll feel the energy within Hannah's feet. I've got her feet against my wrists and forearms. I'm feeling the energy as to where they want to go, so I'm taking their lead. This is a very lovely treatment to have done, but it can feel a little bit strange at first. Some people just want to hold on, and it's so nice when they let go. So now for my favourite part of core therapy treatment. This is called a sacral float. So this is called Qigong, and Qigong is tuning into the energy within the pelvis, like the Chinese call the sacrum as actually the sacred bone. Now S2, there are 5 fused vertebrae within the sacrum, and S2 is a really important part of the sacrum because that is where the cerebral spinal fluid tube that comes all the way down beside the spine and then wraps around S2 and comes back up again. So I've got my palms over S2 and I'm feeling for what the pulse rate of that cerebral spinal fluid is doing. You know, scientific research has shown us that unlike the speed of the breath or the speed of our pulse, actually the cerebral spinal fluid pulses at its own rate, so that fluid comes up around our brain, down our spine, wraps around S2 and back up again to do the same again. Probably every 5 to 10 seconds, so around 12 times a minute. And I'm tuning into that feeling there. It's almost like a swelling each time it wraps around and comes back up again. And it will make the pelvis rock maybe slightly upwards, slightly downwards. And so you'll notice that my hands are on top of each other. There's a lot of heat there right now. Both of my palms and fingers are facing north towards the head, and they're feeling that sensation of warmth and the rocking. If you look closely, you'll notice that my hands are moving very slowly in actually a clockwise rotation. They're resting very gently on Hannah, so a little bit more than a butterfly. They're just touching, if you like, but she will definitely be tuning into the heat, her energy, which is being activated with this sacral float, and she'll be tuning into some colours behind her closed eyelids. Quite often at this stage, people will see the colours of purple and green purple to do with spiritual connectedness, and green to do with healing. So my eyes are closed for this section as well, because I am tuning into most likely the same colours, because sometimes I'll say to people, I'm getting blue right now, and they'll say, oh gosh, that's amazing, so am I. Blue is to do with the throat and opening up and respiratory and water. So now I'm coming back up to one hand on the back of her head, very, very lightly on the cranium. And my thenar, the base of the hand, is actually touching the base of the neck. So I'm feeling where the cerebral spinal fluid is coming up around the neck and brain and back down. So I'm feeling that pulse, bottom to top. And then what happens generally now is that will release, and I'll feel my hands widening away from each other. So coming back now to do a little bit more tweenar, just to see if the spine has released even more now that I've treated the leg repatterning, the foot repatterning, the sacral float. And I don't know if you can notice this, but her spine and her pelvis is moving so much better now. It needs to move fluidly, not like it's one long rod, but actually that each vertebra is separate. Lovely rocking mechanism, especially around the pelvis, around that sacrum, around the edges of the sacroiliac joint. I've got my thenars into the lumbar, the lower thoracics, all round the latissimus dorsi, up into the trapezius. I'm just showing there the area that was full of tension, that is actually so much better now, getting my thumbs and my thenars into there. Really good release. Separating that left shoulder, and now doing a fantastic manoeuvre called a wing stretch. Because of Hannah having suffered a little with headaches, I'm going to make sure that her shoulder and therefore her neck are working independently and they're not fused together or too tight. So this is beautiful. This is making sure that the scapula is separate. Coming in a lovely rotation there to unhinge that tightness, and then massage it again. Ensure it's loose, warm and free. Coming round to the other side. First of all, a little rotation into the deltoid, trapezius, to make sure that that shoulder is released. And then a lovely manoeuvre. I'm using my fingers to bend her elbow. I'm constantly saying to her, everything's okay, you can release, it's all right. And I'm picking up her scapula, using my fingers into the edge of the scapula to bring it forward, wrap it round, and circle it away from the vertebra. A little rotation, a little tug, and back on the couch. Lovely. Okay, a bit more warming. I'm just checking all the time that everything is loosening up. She will definitely sleep well tonight. So this is a fantastic treatment. This is something called the drunken walk. So it walks up and down with my thenars in a downward direction, just along the thoracics, from the very top thoracic T1, down to the base of the lower ribs, T12. That ensures that the erector spinae, which is the muscle either side of the spine, is loose, not too strained. And now I'm using my whole palms flat on the scapula to ensure warmth and release. I've got my eyes closed in order to tune into her energy. And what I'm feeling for here is to check that the scapula are loose, that they're not fused to her back, they're not fused together, nor to her spine. And if you watch closely, you'll notice that my hands move sometimes together in the same direction, sometimes together away from each other, but sometimes independently, one down and one up, as I'm doing here. A beautiful scapular float, tuning into the energy of the upper back, resetting the scapula, the vertebra and all the muscles to bring harmony to the whole body. This tunes the therapist and the client into the most amazing energy. And slowly I ask Hannah to take a couple of deep breaths, to bring herself back into the room and turn over slowly, ready for further treatment. So here I am, Hannah has turned over, and the first thing I do is I have a good look down the length of her body, and I'm looking for any discrepancy in her leg length, her hip rotation, and up the higher parts of her body, her shoulders, her clavicle, and her head. I'm feeling into the lower leg, the shin, down into the ankle and the foot, to make sure that none of it feels stuck. Because quite often the bone, the muscle, etc. can feel like it needs to have some warmth and some give. I've got my thumbs into that beautiful kidney area of the foot, and then giving her whole legs a little shake and a stretch to ensure correct calibration down her body. Now this is a beautiful technique, so nice to receive. I've put my own knee underneath Hannah's left, and I've got both hands, palms and fingers around the knee, around the patella bone. I'm feeling into the tendons and ligaments, making sure that the soft tissue is allowing the patella to move, to have some give to it, and also that there is some warmth there. You can see me gently palpating the knee, making sure there is softness. And this is an area that came up in the test earlier. And now I'm going to ask Hannah to visualize a beautiful yellow lotus flower deep within her knee, and that it is gently opening and blossoming. And as it opens, it's extending its healing energy within her knee and into all of the mechanics. The lotus flower is connected with a Qigong energy, a healing energy that allows Hannah's own healing response to look after its body and ensure correct health. It's quite a different kind of energy to Reiki, so Qigong is one I've used already many times within Hannah's treatment, for instance on the sacrum. I'm using it again now for me to be able to tune into Hannah's knee but also for Hannah's own healing response to take ownership. There is a little bit of movement still, so what I've been doing is tuning into creating some energy and some softness to her knee. And now I'm making sure that the warmth and the energy is resonating from her knee and outwards. And having done the knee, I'm now making sure that the ankle has also been stimulated by that energy. The ankle came up in the tests earlier, and so I've actually got one thumb into the top of the ankle, the side of the shin, and the other hand on the foot to rotate at the same time. Now I've wrapped my thumbs around the front top of the iliac bones of the hips. I've got my palms and fingers around the iliac, and I'm not only looking at first, once my eyes are open, to make sure that the bones of the hips are not too rotated in one direction or higher or lower. But once I've done that, I close my eyes and I again tune in to the Qigong healing energy and the warmth of Hannah's hips and within the pelvic structure. This is a beautiful feeling of resonance, a very soft vibration within the healing pattern of the pelvis. Occasionally my hands will press more deeply on the front or the side of a hip. Sometimes they will form a circular motion, like a clockwise motion perhaps. And once I'm happy with that area, I'll move on. So as you can see, I'm working up the body. I'm slipping one hand deeply underneath her back, actually about halfway across, so that my hand, palm facing upwards, lies underneath her back, immediately underneath my left hand. So this is an area of the abdomen just underneath the tummy button, and my palm is on an area called Ren. And Ren is a Chinese acupressure meridian point, which is all to do with whole body good health. It's really essential that Ren is happy. If Ren isn't happy, neither are we. Another area that needed a little bit more TLC, that was obvious from the kinesiology muscle test at the start, is where I have my hands now, and that's more to the left of Hannah's abdomen, and that's an organ called the spleen. I'm now tuning into the bright yellow colour that the spleen needs to resonate. Occasionally I will ask the client to also visualize a colour once I'm over a particular organ, and in this case it is that lovely bright yellow colour like sunflowers and buttercups. It's interesting actually, once I feel happy with an area, I move on. And sometimes It might take several minutes, sometimes it happens quite quickly. And now working up the body, I'm working on Hannah's right arm. This is called arm repatterning. It's a beautiful technique where I'm actually twisting the lower arm, meanwhile securing the elbow and the wrist in order to unwind any tension within not only all of the arm muscles but also deeply within the shoulder and the neck. This is where we use the arm as a lever to work on the neck. As you can see here, I've actually got my eyes looking out into the room, and sometimes that helps me to look away from the area I'm working on, to tune into it more, so that I'm feeling with my hands and feeling not only where my hands are, but I'm feeling right up into the shoulder and neck. So the tweenar that you'll have seen on the previous video, where I'm working on Hannah's back, can also be used on other parts of the body. And here I'm working tweenar into the elbow, the forearm, and the rest of the arm, because I could feel that there was some tension and some stuck joint into the right elbow, that it wasn't giving, it wasn't soft enough. What I'm doing now is an arm float, so this is really beautiful to receive. I'm holding the hand and wrist, and I'm not pulling much at all, but very gentle maneuver. And this is like a communication with the shoulder and neck, asking it to release. And once I've done the arm float, I just revisit very briefly the arm repatterning once more to make sure that it feels better. Because if something doesn't feel better, it's important for me and for the client to revisit that area until I can feel some healing going into that area. Now working on Hannah's left arm. This one feels quite different to the right. The right had come up in the muscle test earlier that the elbow wasn't happy. This one feels much better, but I'm just making sure that there isn't any tension there that's drawing the neck over to the left hand side. It does look like a strange maneuver, but actually it's so nice to receive once the client lets go. If there is tension there and they're holding on, or they're even trying to do the maneuver themselves, it just won't work. It's all about trust and making sure that the client completely lets go and trusts you. Now for an arm float, again holding the hand and the wrist to ensure that the neck and shoulder and arm are letting go. Allows therapist to connect with client in the most subtle of ways, connecting in a beautiful, healing manner while reassuring the client through touch that all is well. And now sitting down in order to connect with the upper part of the torso, shoulders, breastbone, clavicle, down the arms into shoulder points, scapula, up into the neck, and then the scalp. In order to make sure the head is aligned correctly, I remove any bulking of hair that will offset the head in one direction, and I'm checking for softness into the breastbone, along the line of the clavicle, and then into the vertebra of the neck. There are 7 vertebrae here, the cervical vertebra. The top 2 are called the atlas and axis. So they're referred to as C1 and 2. And you can see here the most amazing feeling. This is incredible to have this done. It's called a neck release. And you can see my fingers are immediately underneath the very top of the neck, because the neck actually comes way up into our cranium, supporting all the cranial bones. And therefore the neck needs to be really strong. It's obviously helped by the muscles around the neck, the sternocleidomastoid muscles, and also the erector spinae around each side of the vertebra. So I'm feeling here at each vertebra, each of the cervical vertebra, to check for softness and movement to make sure they're not fixated or subluxated. And you can see here I've got my fingers directly underneath the C1. It's actually trying to go between C1 and the occiput bone. The occiput is the base of the back of the head. So what I've done is lifted the head, making sure I've got the full weight. And then I make sure my fingers are in a nice straight line, connected at the little fingers, no gap between, and then let Hannah release backwards onto my hands. And what that does is it encourages the occiput to release its grip onto the top vertebra, the C1 and the C2. And when that is done, it has such a releasing effect on the body. I've noticed a lot of my clients may have had accidents, injuries, for instance whiplash. Whiplash isn't necessarily from car accidents, it can be from trampolining, sporting injuries, or simply falling over. And when that happens, the body goes into a self-protection mechanism whereby the C1 will attach itself beautifully, unfortunately, into a gap in the very lower mid part of the occiput bone. And when a core therapist does this, they will be looking for an attachment there that shouldn't be there, and then they will make gentle effort to release that. And that sort of effect may take weeks, months or years depending on the nature of the fixation. So you see here I'm continuing to work on Hannah's neck. This feels so nice. Hannah always loves this treatment. So I'm checking the vertebra that there is some softness and movement. This is the beautiful neck release that I explained, where I lift and then allow her natural head weight to tilt the head backwards. This must be done naturally. It shouldn't be done with Hannah trying to make an effort to push her chin up and her head back. And I certainly can't force it. You have to be really careful with the neck. So this is all done naturally. So as I'm working on that muscle either side of the neck, that is also ensuring not just the vertebra, but the erector spinae and the sternocleidomastoid are also not strained and not in spasm, that they're loose and soft and able to support Hannah's head and neck correctly. So I have one hand underneath Hannah's occiput here, the bone at the base of the scalp, and one hand towards the shoulder and the shoulder point, and I'm encouraging a looseness there. And what should be happening is Hannah's right shoulder should be bouncing back as I push it. It's bouncing a little, but I do want that to bounce back a little bit more than that in time. That's the sort of thing that would happen over the next couple of weeks. A nice long stretch. This feels so nice to have done, especially for people who work over a computer for hours and are hunched or have bad posture. A beautiful treatment on the neck, the shoulders and the cranium. Most core therapists will work on the neck in every core therapy treatment. Depending on the kinesiology tests, passes and fails at the start, each core treatment will be different from another, because therapists work based on what they find, but also intuitively, working where they feel that the energy of that person needs a little help. Having done a little soft manipulation of the neck and shoulder, I'm now working with Qigong once more to the neck. So I'm simply holding flat palms and fingers softly under the neck, the bones and muscles, to tune in and bring it warmth, healing. And this is a typical time when both therapist and client will often see colours behind closed eyelids. It's interesting actually, because quite often at this point the client is already deeply relaxed, and I would want to remind them that behind their closed eyelids they may be able to see colours right now, and it's a sort of thing that you only realise if you look for them. So I've moved my hands slightly so that my full hand palm fingers are now underneath Hannah's cranium, with my fingers just touching the very edges and length of C1, which, if you were to see it on its own, it's actually quite a sliver of a bone. It's not a bulky bone like most of the rest of the vertebra. So it reaches quite a distance along underneath the occiput. Meanwhile, my thumbs have now moved to each side of Hannah's temporal bones, and the energy is quite intense, profound at this stage. This is called a temporal and spine float, where the therapist is actually tuning into not only where they're holding, but also the whole spine. This may take a few minutes depending on the client and their situation. And what I'm doing is I'm actually visualizing the whole spine, and I'm working through from the very top to the very base of every vertebra, and tuning into it to make sure that it's not fixed, that it's soft and loose, that there is movement, it's not misaligned or fixated to another vertebra. And in my mind's eye, I'm actually visualizing the spine just rocking slightly, like a snake moves from left to right, I'm just seeing a very minute movement in my mind's eye of the length of the spine. And each vertebra receives individual treatment. The connection is profound and intense. It works so deeply. It leaves both of us feeling very much in tune. I very carefully release my hands, very respectful of the energy around Hannah. So once I've updated my notes, I ask Hannah to take 3 nice long breaths, keeping her eyes closed and slowly acclimatizing back into the room. This is a process I do with all of my clients after any of their treatments, because it enables their mind and body and their spirit to regroup, recalibrate, and prepare for the rest of the day. I then ask her to be aware of her feet and toes, to give them a little stretch and send the oxygen down to that part of her body. The same with her hands and palms. Then I ask her to breathe into her hips and move her hips a little. And then perhaps breathe and stretch down one leg and then the other leg. Lengthening and realigning the hips. And then once she's breathed into the abdomen and torso, into the shoulders, ask her to rotate them slightly in one direction and then back again. And by now she's feeling far more awake and alert, full of oxygen. So then I ask Hannah to raise her arms above her head for a nice long body stretch. And once more, we revisit some of the muscle tests that weren't happy at the very start. This one's called an IPSY test. It's a one-sided test of arm and leg. I'm only retesting the ones that had failed. That was a really good thumbs up, nice and strong. Same with this one, and I was putting a lot of pressure on there. So that's really good news for the joints that I was working on, her right elbow, left knee and ankle. I'm now retesting the ASIS. It's actually the tests for the hips, the pelvic structure. I'm looking at how the pelvis may have been twisted before and hopefully is now back in alignment and supporting her correctly. And every time I'm retesting, I'm looking for any weakness, and all of these are coming up really well, how should be expected after a thorough treatment in this way. And now looking at the pelvic structure, I'm testing what we call the ballet test to see if each hip is happy opening to a small, medium or large extent. And Hannah's right hip particularly, you'll see here the alignment isn't as loose and relaxed as it could be, although it is much better than when she came in. So each time she has a treatment it certainly helps, and she's feeling the benefits of that in everyday life, which is good. So now I'm going to check the abdomen. First of all, the rear acupressure point, also called the conception vessel. And then looking at the spleen, another little test. And I'm putting quite a lot of pressure on there, but she's doing really well. She can probably notice the difference in the tests from the start to the end of the treatment.